Welcome back to the Pearl Report. Half of the estimated 800 sufferers of rare diseases in Hong Kong are children, but the government has no official policies to subsidize them. Producer Yan Zhou looks at how patients are struggling to live as hopes dim to obtain long-awaited life-saving drugs.
Abby Ho, aged 5, has been on life support since birth. Abby has type 1 spinal muscular atrophy, or SMA.
This is a disease caused by a genetic mutation in the SMN1 that lead to degeneration of the motor neuron. Muscle innervated by the motor nerve would be weakened and atrophic. People named different severity according to type 1, type 2, and type 3. Those with type 1 have the earliest onset of weakness, and usually before 6 months old.
During the second month, when I lifted her arms, they were floppy. It took her quite long to finish 1 bottle of milk. Her crying was very soft.
Most of the time, the children will have hypotonia, less forceful kicking. Crying is not as loud as before, easy choking.
SMA affects a range of 1 in 6,000 to 1 in 10,000 births.
Most of the children with SMA type 1, if without any treatment or medical support, they will die before the age of 2.
We were heartbroken.
At 4 months old, Abby started to have difficulty breathing.
As the child grows, the respiratory muscle is weakened, so they have to breathe faster or to use more force, try to keep up with the breathing. Sometimes when they cannot do so, they need to have some external support to help them to breathe.
Initially, Abby used a respiratory mask.
It sometimes blocks her vision, for her to see things, and also it puts a lot of pressure on her facial bones and her forehead. Almost every day she needs to be resuscitated. We finally made a decision for her to let her breathe through a tracheostomy. Very easily, we can just clear her airway through the tracheostomy.
They will be prone to have pneumonia, the effort to cough out, and to clear up their own secretion in the airway will be weaker.
Abby spent 3.5 years in hospital.
They are very fragile medically, and a simple cold and flu can take their life away. We don't want her to grow up at the hospital. She should explore the world more.
So they brought her home to her own bedroom.
Our room is a connecting room with hers. We try to simulate a hospital ICU.
The equipment operating round the clock include ventilator, oximeter, cough assist machine, etc. They cost some 250,000 Hong Kong dollars.
Many of the most costly items, we were very lucky enough to get a sponsor from the patient support group, but we had to buy some. The one on a rental basis, it's around $10,000 a month. Right now, we are only getting disability allowance from the Social Welfare Department. It's $3,300 per month, and that is only enough to cover us partially on medical consumables, maybe the syringe or the feeding tube. I need to take care of her. So my husband is the only source of income. He now works 7 days a week. She did a procedure to install the gastrostomy tube for feeding because she cannot swallow because she would choke herself. When Abby was just over a year old, she was still able to smile. She is able to make some sound. And sometimes I ask her, "Can you call me Mama?" And you hear her saying back to you, and I just take that as a mom. We communicate with her through her eyes and with her hands. Sometimes she waves like this.
Marcus aged 5, also has spinal muscular atrophy.
His onset was at 4 months old. Before that, he could move his feet and more of his hands. He can stick his tongue out, but he's gradually losing his agility. For instance, his hip joints will change shape. His hamstrings or his hand sinews will start to bend and he'll develop scoliosis.
He has physiotherapy twice a month at home.
It's important to loosen his sinews. If you don't do it, his muscles would atrophy quickly.
Wennis has spent 88,000 Hong Kong dollars on rehabilitation paraphernalia.
We bought him a passive bicycle to help exercise his feet. A standing rack, good for his bone development.
And gear to exercise his arms.
He can only move part of his upper limbs and 1 or 2 fingers.
Marcus attends primary 1 at a special school. He also has therapy at Po Leung Kuk to strengthen his fingers, learn how to control a mouse, and improve his speech.
Whether going for medical checkups or to school, we need to take a rehab bus. It's best if he can do 2 appointments a day. He won't be too tired. We need to monitor changes or any special problems in his health. Then we request to see some specialists. No doctor has ever said your SMA child should go to which medical departments or given us a list.
But plans are in the offing.
A project called Where for Rare. Pediatricians, physicians, or clinical geneticists will formulate an overall care plan. Case manager would arrange clinics appointment, transportations, and when these patients actually get sick and admitted into the hospital, they can have a very quick review of the rare condition and what are the important issues to pay attention to.
SMA is incurable. Last December, the U.S. Food and Drug Administration approved a drug called Spinraza to treat SMA. Parents of SMA kids regularly monitor patients who've started on Spinraza.
Children up to the age of 2 still for SMA type 1 do not require ventilator support. They maintained their motor performance. Some can gain the ability to sit.
I really hope that one day she can not be attached to any medical equipment. She can live her own life happily, be a healthy and happy girl. But then after we saw the price tag, then we were overwhelmed as well.
It's a lifelong treatment costing 6 million Hong Kong dollars for 6 injections in the first year and 3 million Hong Kong dollars from the second year on.
It's so expensive. Even a few generations of my family will sell blood. We will not be able to afford it. I beg you to save our children.
Spinraza is available in the United States, European Union, Canada, Japan, and Turkey, but not in Hong Kong.
We have to ensure citizens will not be denied proper health care due to a lack of means.
I think it's really a rhetoric, a slogan, and unfortunately, it becomes a lie to many patients who are, simply because of lack of means, cannot receive life-saving medications.
The hospital authority notes Spinraza is not yet licensed in Hong Kong.
HA would not consider listing unregistered drugs on the drug formulary, nor giving financial assistance to patients for use of unregistered drugs.
The initiation of the licensing process will be by the pharmaceutical company.
HA has been in contact with the pharmaceutical company concerned to better understand its plan.
The crux is public funding.
In overseas countries, they oftentimes develop contracts to put a cap on how much the government would spend on certain medications. They based on the calculation on how many patients they might be utilizing the medication, the cost of the medication. It's really the government's role to negotiate with these huge pharmaceutical companies.
Dr. Chen says another barrier is Hong Kong has no definition of rare diseases.
Overseas, to facilitate the development of these important or novel drugs for the rare disease, they have quite clear legislative guidelines, but rules and laws to support it.
The Food and Environmental Hygiene Department says
definition of rare disease varies among countries with different characteristics of the respective health systems and situations.
Without a definition, no policy can be formulated. When you think about a policy, the first thing is which group of people this policy should take care. The drug expenses every year and other social support expenses.
They're losing their abilities, like bit by bit.
Time is not with us. Our next step is to host a fundraising event while waiting for the government